Hi, my name's Greg Fell. I'm Director of Public Health Sheffield. So this is a short video on the position statement as of today, the 3rd of November. In two parts, one about the epidemiology and two about the lockdown that following the Prime Minister's announcement at the weekend. So epidemiology, it continues to hot up. Nationally, rates are continuing to rise in most of the country, with some caveats. I'll come on to the caveats in just a minute. Rates are definitely continuing to rise in all age groups across the country, and Sheffield is no exception to that. Then more specifically in Sheffield, you'll remember back in the summer, rates were in the region of 20 per 100,000. They peaked at about 450 per 100,000, and now they're beginning to settle back down in Sheffield. So we've reached a new plateau. It's a plateau that's much higher than is comfortable for any of us, but certainly we have reached a plateau and rates are beginning to flatten, but much higher than any of us want. What we'd seen is that in areas that had put restrictions in place, they achieved the desired effect and rates started to come down, but then everyone got fed up and rates starts to go up again as soon as we take our eye off the ball. So continuing to stick with the programme remains really quite important for us. So in terms of where this is in Sheffield, principally household to household transmission, with some exceptions, but mostly across the city. But the east of Sheffield is becoming more of a concern. This is a pattern we saw last time round. Many people in more manual jobs, many people who have frontline facing jobs that work in retail or work in supermarkets or work in the health and care industry can't work from home like I can work from home. That increases the chances of infection. So those types of jobs are more concentrated for people that live in the east of the city. As a result, infection is beginning to concentrate in the east of the city, and that becomes a concern. But principally, household level transmission. Our intelligence tells us that most of the infection is from people that we know rather than from strangers. Trend, as I say, we're beginning to flatten off. At their height, rates in Sheffield were 450, 480 per 100,000. They're now actually beginning to come down, principally driven by a significant reduction in the rate in the 18 to 24-year-old group. That was the student population that came back to Sheffield a month or so back. The rates in 18 to 24s are now back to about the Sheffield average. Rates are still rising in the all other age groups. Most concern is these over 65s, but the rate of growth is beginning to flatten. So that's good news, but the bad news that goes with it is that those rates are much too high. That's a pattern that's been seen across South Yorkshire, and Sheffield is probably slightly ahead of that curve. So our rates have been flattening for quite some time. What I suspect we'll see is fluctuation. So in summer, what we saw is fluctuation up and down, a really low rate. What I think we'll see now is fluctuation at a much higher rate per 100,000. Rates are going up through the age groups. Significant numbers of infections in the over 65s. That is a concern. Positivity is still really high. So positive of 100 people with symptoms who get a test, 14 of them, or 14%, will test positive. Earlier in summer, that was 1.5% to 2%. So positivity is much higher. Rates are much higher, but flattening, and rates in the elderly groups, who are much more likely to have severe illness, are much higher than is comfortable for any of us, but fortunately beginning to flatten. The hospitals are really quite busy, the two concerns there. One is the point at which hospitals become so busy that they have to scale back elective care. That comes with consequences, and no hospital anywhere would wish to do that, but that has happened in other parts of the country. We're at an earlier part of the epidemic curve, but hospitals are beginning to become really quite busy. Add into that winter. Winter is here, and winter comes with a whole bunch of illnesses that are usually associated with winter, most commonly flu. Flu season hasn't really hit yet, but it is coming. The aside there is get your flu jab if you haven't already done so. So winter and COVID and potential to have to scale back elective care, so routine surgery, is a real concern. So something that remains a concern for me in terms of needing to keep the level of community transmission of infection as low as possible. We've not yet seen a substantial increase in deaths, but that will sadly come. There's no doubt about the fact that the deaths lag behind hospitalizations, which lags behind infections. So that may come, probably not quite to the same level as we saw in the last peak, but it will come. Secondly, lockdown. So we've all heard the Prime Minister's statement that he's putting the country into what is in effect a lockdown or an intensification of interventions that restrict certain industries and our social mixing from tomorrow, Thursday. The reason was really simple. Was the paper that Sage produced for the Prime Minister that we on current trends we are predicted to breach the number of infections, hospital admissions and deaths well beyond the reasonable worst case scenario. And that's across the country, and that's the reason for the change in strategy. No single thing has led to that. We relaxed the first lockdown in early summer. That inevitably led to more mixing of more individuals, and that leads to acceleration of the spread of a virus. We may have become desensitized and tired of the messages. A high proportion of us are still susceptible to the virus, so 94% of us are still susceptible to the virus, and we're spending more time indoors. Winter is coming, it's getting colder, it's getting windier. Indoors is more risky for viral spread than outdoors. So there's no single thing that led to the significant increase in rates, but collectively a lot of things did. How long will this be? It's difficult to tell. The legislation that's laid before Parliament is for a month. It will be reviewed in a month. It will be reviewed before the end of the month. Whether a month is long enough, I don't know. So there's a delicate balance between getting R naught below zero. Currently, it's between 1.3 to 1.5, there or thereabouts. We certainly won't get the level of circulating virus down to the levels we saw in summer. There's no way that will happen. They're too high to get them down to the summer levels of 20 per 100,000. Currently 350 per 100,000. But if we get them down enough and keep R naught, R zero below 1, then that's bought us some significant time. In that time, we need to ensure that our testing, contact tracing and isolation are working better than they are at the moment. They're working, no doubt about that, but there are some significant problems that need to be addressed. Some of those are national problems, some of those are local problems, which I and my team will be addressing, and need to reflect on how we continue to adapt our behaviour and stick with the programme, because sadly we'll be living with the virus for some considerable time to come, so we all need to adapt our behaviours accordingly. So the purpose of the lockdown is to get R naught below 1, and by reducing the level of social contact and the level of mixing between individuals, there's no doubt that we will do that. It's probably worth us reflecting on resetting our expectations and our behaviour. It's definitely worth us reflecting on the economic and social harm that will come from lockdown. There's no two ways about that. We can't avoid that, and it doesn't change any of the fundamentals. The fundamentals will remain this throughout. If you've got symptoms, get tested, isolate yourself, and if the test is positive, your contacts will be contacted and asked to isolate as well. We need to make sure that happens as fast as possible, and as complete as possible in terms of coverage. But staying at home if you've got symptoms or a positive test is by far and away the most important thing we can do. Limiting our social contacts, the number and the nature, the more contact we have with the more individuals, the more opportunity there is for the virus to spread and to accelerate through the population. You can call it bubbles, you can call it whatever you want, but the more contacts you have with the more humans, that will spread viruses. And the simple individual messages around distance between people, hand washing, face covering, goes without saying, but we'll say it again because it really, really, really does make a difference. So the choices that we all make are the things that will make a difference, and that won't change throughout. We definitely are all in this together, and the fact that we try and do this as a city will continue to make as big a difference as we possibly can. The last thing I'll say is people will want magic bullets. What is the intervention that will save? There isn't a single thing that will save us. Even the vaccine, when it's available, it'll take us probably quite a long time to get the whole population vaccinated. So we're going to need to stick with the programme for a considerable period of time to come. Yes, I will ensure that we improve contact tracing and isolation. We will all need to adapt to a new way of operating, both physical, social environment stuff, ventilation, spacing, remote working where that's possible, and we'll all need to rethink the behaviours that we all do to limit the spread of the virus.